Excellency, colleagues, ladies and gentlemen, a pleasant morning to all of you. I'm Dr. Slavut Bunsuk, Acting Inspector General, Ministry of the Public Health, Thailand. In this session, I will present about the overview of the minimal standards and guidelines on actions to protect children from the harmful impact of marketing of food and non-alcoholic beverage in the ASEAN region. The objective of the guideline is to provide an outline of the guidelines that can be commonly applied across ASEAN member states to adequately protect children from the harmful impact of food marketing, and its purpose is to guide Asian member states on the technical and practical aspect of the development, implementation, monitoring, and enforcement of legislation to reduce children's exposure to the marketing of unhealthy food. This is the reason on why should we have to the guidelines. There are high volume of unhealthy food marketing across ASEAN region, and unhealthy food marketing increase energy intake, leading to overweight. You can see the trend of the overweight and obesity among school-age children are not higher in all ASEAN member states. In this guideline consists of the 12 minimum standards based on global and regional evidence. In the following slide, I will go through each minimum standard. Minimum standard 1 present the complexity of overweight and obesity, which has many causes of consequence operating across the life course. Food marketing policy are one of the measures that are required to prevent excess weight gain across the life course. Minimum standard 2 recommend adopting mandatory government legislation. As the sample country below, in South Korea, found that the volume of the unhealthy food advertising reduced significantly, around 60% after introduction of the Special Act on Safety Management of Children's Dietary Life. Chile showed that a comprehensive mandatory can reduce the exposure of unhealthy food marketing on television and around 15% reduction in child direct marketing after implementation. You should also emphasize on the regional cooperation, since one country alone cannot fully protect children from all unhealthy food marketing. The majority of the suppliers and the manufacturers of these products are global or ASEAN multinational countries can only control food marketing that originates in their own country. Food marketing that originates in another country, for example, to online platform, must comply with the legal obligations in the country of origin, unless measures are also taken to regulate digital platforms to prohibit the publication of such marketing. Regional cooperation on restricting food marketing may be enabled through regional agreements on the minimal standard required to protect children from the harmful impact of food marketing. Minimum Standard 3 provides the implementation of the comprehensive approach covering all marketing settings and media which children are exposed. Minimum Standard 4 covers the importance of setting clear and measurable short-term, medium-term, and long-term policy objectives, which is the essential for effective policy design. Those objectives should clearly state what the policy intends to achieve. Defining a child as up to the age of 18 is discussed in Minimum Standard 5. The definition is based on UN Convention on the Rights and Child and Young Person Protection law similar across the ASEAN states. Minimum Standard 6 should cover 7 P's of marketing strategy, which are product, place, price, promotion, physical evidence, people and process, including other marketing methods we face every day. To ethically protect children from the harmful impact of food marketing, the definition of marketing to children must encompass all unhealthy food marketing to which children are exposed regardless of the intended audience or whether it is directed to children or not. It is outlined in Minimum Standard 7. Minimum Standard 8 outlines the importance of having in place an evidence-based food classification system. The WHO nutrient profile model have been specifically designed for the implementation. These nutrient profile models are based on robust scientific evidence of the health impact of different food groups. If existing food classification system should be tested against national dietary guidelines and the WHO models. Minimum Standard 9 calls for a comprehensive approach, adequately and effectively capturing the full range of the communication media and setting where children are exposed to food marketing is required. If a state approach to implementation is adopted, governments must prioritize media and setting which are time-bound implementation plan. Additionally, it may be useful to consider political feasibility and potential export and power of unhealthy marketing to children. Minimum Standard 10 is to ensure that a lead government agency is given responsibility for designing and implementing the law that has the jurisdiction over different areas. Minimum Standard 11 provides information on conflict of interest, which arises in circumstances where there is potential for a secondary interest. In this state, clear and transparent process for preventing and managing conflict of interest should be established as early as possible before legislative development begins. And finally, Minimum Standard 12 discusses the importance of monitoring and evaluation and enforcement mechanisms to ensure compliance. That's all of the overview of the minimum standard and the guideline on action to protect children from the harmful impact of the marketing of food and non-alcoholic beverage in the ASEAN region. I hope we have a productive discussion and experience sharing after this. Thank you for your attention. สวัสดีครับ